how I've missed this place.
Well, you can do more.
Thank you, John. Okay. Well, thank you all for coming, particularly on pretty short notice. Today's press conference was not something that we wanted to hold or anticipated that we would need to. We've been brought together mostly through a self-inflicted problem. Close to half of our population has refused to get a vaccine that is safe. It is effective against severe illness, hospitalization, and death, and it's absolutely free for the asking. Those low vaccine rates have allowed the twice as contagious Delta variant of COVID-19 to spread like wildfire across the country and now our state. In response to the spike in hospitalizations and deaths, the CDC has updated its guidance to recommend making masking indoors in counties with high COVID-19 transmission rates. The CDC recommendations extends to all Kansans, vaccinated or not. This is happening because the Delta variant is significantly more contagious than previous variants. Just one person who is infected with COVID Delta can carry upwards of 1,000 times the viral load as a patient infected with a previous version of this disease. As I said yesterday, this administration has consistently followed the recommendations from the experts at the CDC. Per my authority under the state constitution, beginning next Monday, state employees, regardless of their vaccination status, will be required to wear masks indoors at work if they cannot socially distance. Additionally, anyone entering state buildings or facilities will also be required to mask up. As you can see on this map next to me, the new guidance was clear. If your county's COVID transmission rate falls into the red or orange zone, which means high or substantial risks of transmission, you should wear a mask. Just as my administration has worked over the last year to create solutions that empower local leaders, the CDC has recognized that the path forward in this fight has to start at the county level. In my role as governor, I have had to work to find consensus and compromise, especially in the heightened political environment in which we find ourselves. Last week, Alabama Governor Kay Ivey said that it's time to start blaming the unvaccinated for the situation we now find ourselves in. Those are pretty strong words. But I would add that this extends to any elected official that has put politics above public health over the last year, or stayed silent and allowed falsehoods and conspiracy theories to replace science and medicine. Playing politics with this disease has caused confusion and ultimately suffering and death. We know that almost every single Kansan who has COVID now and is in an intensive care unit bed is unvaccinated. By the time you reach the ICU, it is too late. The deaths from COVID Delta could have largely been avoided with a simple vaccine. Let me be clear, these vaccines are safe and they save lives, period. If you aren't vaccinated, I implore you to get yours today, tomorrow. I want those Kansans who wore masks and got their vaccine to know that I share your frustration. No one likes wearing a mask, myself included. I'm deeply appreciative of your willingness to protect your friends and neighbors through this pandemic, and I take no pleasure in asking you to put a mask on again. Over the next few weeks, we will continue our efforts to get Kansans vaccinated. My other immediate concern is for the well-being of our children going back to school in just a matter of weeks. Later this week, my administration will be releasing updated guidance for our school districts. As you know, school health decisions fall under the purview of the state and local boards of education. However, my administration will be standing by with guidance, support, and tools for any school district that needs our help to protect their kids. I know the last year has been extraordinarily challenging, but the circumstances have changed considerably. We have a vaccine, our economy is strong, and we are making great strides. But the Delta variant has put the people of Kansas at another crossroads. The bad news is that cases are rising in many parts of our state. The good news is that we have a vaccine to protect us from the virus that is safe, it's effective, and it's free. I strongly urge every Kansan who isn't vaccinated to get one right away. That's the best way, maybe the only way, to stop the spread of COVID in our state. For those vaccinated, I ask that you speak with your friends, your neighbors, your loved ones who are unvaccinated and encourage them to get vaccinated to protect themselves and our state. And with that, I'll take questions.
Governor, this applies indoors for state employees only if they can't socially distance or in?
This applies if they're not able to socially distance or in all public areas. So if you're walking in the hallways, you're on the elevator, you're in the bathrooms, those kinds of places, mask on. If you're in your own office and you're distanced from other people, you can take your mask off. It's pretty much the same we had when all of this began.
Governor, given that SB 40 has been ruled unconstitutional, is a new emergency order and statewide mask mandate on the table?
We are really not focused on that at all. We are so focused on getting vaccines into the arms of people. We don't want to spend a lot of energy thinking about that or diluting our resources in ways that will distract from getting these shots in arms.
Governor, a lot of states have turned to enticements to try and get people to take the vaccines. Is that something that you guys are considering here?
Yeah, we are. We've actually been looking at that for a while, but we're also evaluating what's been happening in other states. And we know that it's another tool, not necessarily the most effective tool, but we are going to try variations on that. We'll probably be making an announcement sometime next week that will give you an idea of what we've got in mind. It has to be something that's more immediate and that's more spontaneous. We know these planned out kinds of things really didn't have long-term positive impacts.
The Department of Veterans Affairs is requiring certain employees to be vaccinated. Is that something you're considering for certain state employees who have direct contact with people or are taking part in vaccination?
Right now we're going step by step. The CDC just came out with these guidelines yesterday. There was no vaccine mandate within those guidelines. So right now we're going to implement the guidelines as the CDC put them forth yesterday.
Katie's question on
Things you can do on your own authority.
Pardon me?
There's nothing here you said today that has to run through the LCC.
No, I have authority to put in the mask requirements in our state buildings.
Going back to Katie's question on SB 40, there is still a larger question beyond COVID about you could have another emergency that you would have to deal with. At this point, do you guys or does the administration know what emergency management law you're working under, whether it's COVID, a tornado, fire, what have you?
Well, I think, Brad, as you know, the judges made it very clear that there is no stay on this particular point. So from our perspective, we've reverted back to pre-SB 40 and the original KEMA Act. And so if we happen to have a flood soon, we would be able to implement the emergency declaration. The difference with those, and we're not thinking about one for anything COVID related, but we have to leave the options open for things like floods, wildfires, tornadoes.
Governor, are you concerned, some people, especially children who were planning to get vaccinated to avoid having to wear masks are now not going to get vaccinated? How do you convince people the vaccine is still effective when vaccinated people now have to wear masks?
Well, as I said in my remarks, I'm as frustrated as any other vaccinated Kansan. You know, I feel like I did my part, and one of the rewards of that was not having to wear a mask. But, you know, that option has now been taken away because of the Delta variant and how much more contagious it is, and how few Kansans, unfortunately, have gotten vaccinated. So we just really don't have an option but to do that, because we need to protect. Even those who are vaccinated can still get the Delta variant and can be contagious, and we just can't have that, particularly in our schools, where we will have kids who are not eligible there is no vaccine for them. So this is a measure we just absolutely have to take to protect the health and safety of all Kansans, including our kids.
Can you characterize how serious the situation is right now from a medical perspective?
Sure, Tim. How serious it is from a medical perspective. Well, a good example is today we had over 2,000 new cases. We haven't seen that kind of a two-day tally for quite some time. Fortunately, the deaths are down nationwide and in Kansas as well. In terms of the percent of the cases that end up having to be hospitalized or die are down 70%, but hospitalizations are up, and hospitals are really getting quite full. We still are seeing some staff members that are ill, and to the governor's point, those are essentially entirely unvaccinated staff members. A different place the hospitals are now compared to 8 months ago when we talked about this was that hospitals had a lot of admissions they didn't need to bring in for elective surgeries and the like. Now one of the things that's filling hospitals are strokes, heart disease, other kind of respiratory ailments. So I think on balance, the trajectory is still going the wrong direction, as per the numbers would suggest. And that's, again, the critical nature of it is prevention and getting vaccine, because it is dramatically successful.
And your order is in all counties in Kansas? Or your name is 52 here?
I'm sorry.
This is for all counties?
Well, you know, we're following the CDC guidelines that make it very clear that the red and orange counties will have, the state employees there will be required to wear a mask and socially distance at work, okay? But if they're in a yellow or a blue county, they won't be required to do that.
Governor, given the fact that so many Kansans remain unvaccinated, can we trust people to mask up indoors without a state, county, or city mandate?
You know, I think we've, you know, had an opportunity to study human behavior over the past 16 months. We know how folks are going to react. You know, that's why I'm limiting, you know, my guidance here for state employees, because in that sense, we have much more control over that.
And you mentioned your administration is reverting to pre-SB 40 and changes to KEMA. Should city and, you know, school boards and local governments also feel emboldened to issue mandates should they so choose?
I think, well, you know, I'm going to leave that to the local units of government to decide, and the school boards to decide how they want to interpret what the judge's ruling does in relationship to Senate Bill 40. You know, I know that there's not a school district in Kansas that, you know, is not fully aware that it's important to get our kids back in the classroom, and that they will take the necessary precautions to make sure that those kids get back into the classroom this year safely, and safe for their teachers too.
Is 6 feet still okay for social distancing, or is that going to go to 3 feet, or what are we talking about?
We're going back to the 6 feet. I know there'd been some talk in classrooms about 3 feet. You know, that really was before this Delta variant, you know, became so widespread. So we're going back to the 6 feet.
Would you encourage private companies to require their employees be vaccinated?
You know, I think private companies are very good at doing what is best for business, and if they think that's what's best for their business, then they would have my support. Okay? Thank you all.